My rehab protocol, I decided to go for a Brostrom repair, which is lateral ankle instability. So, in other words, it's all the ligaments on the lateral side of the ankle, which includes the ATFL, the anterior talofibular ligament, the PTFL, the posterior talofibular ligament, and the CFL, the calcaneofibular ligament. With this usually happens with repeated ankle sprains. So if you have repeated ankle sprains, it causes a lot of stress on the lateral ligaments, which can actually cause them to be extremely lax, which is actually it's not good because they're not stable. The sutures after the surgery are usually removed from 10 to 14 days after, but there is still we're going to have a brace on them or a splint until there's little to no edema. They're actually going to be immobilized for 2 weeks after the surgery. There's 2 to 4 weeks after they are going to have 50% weight bearing, so they're only allowed 50% to be able to walk 50% with their weight. So of course they're still going to have assistive measures like crutches or a walking boot. Then 4 to 6 weeks after, they can do full weight bearing. Then they still do brace for 12 weeks after the surgery. So for phase 1, we have encompassing strengthening. Our goal for that is to strengthen the hamstrings and the quads. That can be started immediately after their surgery because it's not, like I said, it's not going to affect that area. It's encompassing, so it's going to be everything around it, not that area. Which we're also going to work on the hip complex as well. So our goal is to work and strengthen the hamstring and the quads and also the hip complex. Then we have phase 2, which is the range of motion. So our goal for that is to get back. We want to get back as much range of motion as possible, but our goal is to get back at least 90%. We're going to be able to tell if we got 90% by comparing bilaterally. This can be done 3 weeks after surgery. Then you have the strengthening phase, which can be done 6 weeks after surgery. You want to make sure that you are making sure you have full range of motion before you strengthen. So our goal for the strengthening phase is to strengthen without pain, and we want minimum soreness because there is soreness rules, and we don't want them to have to go back a phase. It'll take longer for them to get back to playing their sport, and that'll just upset them and everyone else. Then you have phase 4, which is sports specific. So this is where we're going to give them challenges, and they have to meet these challenges, and that's our goal, is for them to meet these challenges without any setbacks. Because if they don't meet these goals or meet these challenges, if they don't pass these challenges, then we will have to hold them back longer until they pass them to be able to go back to their sport. And that's done 8 to 12 weeks after.